Okie dokie. So this is a little mini pregnancy Pilates, little set of exercises for you. A little bit of mobilization, a little bit of core engagement, a little bit of challenge, and some side to side work because we've got some planks. Or some side planks. So we're going to come to the all fours position. So planting your hands nice and strongly, trying to stretch out through the wrist. But if you have any wrist issues, you can just make fists, or you could raise up your hands and just kind of roll up a mat or something like that. So we're going to come onto the all fours, just planting yourself in a nice box position. So like I mentioned, hands are flat. You're drawing up through the wrists, elbows, shoulders, nice flat back. And as and when you're ready, it's a gentle movement. It's a tuck, it's a release. It's a pelvic tuck, and that's going to help a lower back, any issues perhaps. And you're going with the flow. So this is cat, but a flat back. So rather than cat-cow in pregnancy. And as and when you get a little deeper, a little bit more familiar, you draw your tailbone underneath you and you round through the entire length of your spine. But you're always going to listen to the body and do your best version. So keep that rhythm going. Breathing in, breathing out. Nice exhale breaths to scoop underneath and to stretch out both the lower and the upper back. If you want to tuck the chin in a little bit more, you might well be softening the elbows as you come back to your flat back and you're tucking and rounding. With regards to pelvic floor, you're going to think about pelvic floor engaging and lifting as you have a natural closure through your tailbone when it tucks under and that back passage gets a little tuck under and you can feel soft when you release. I'm just going to come to the side and show you this side on version. So you're going to do as many or as few as makes sense for your body. So you don't even have to put a number on this. You're just going to breathe in your neutral, exhale. Breathe in. When you're ready, exhale breath, tucking underneath. Inhale, pause, exhale. Perfect. So that's a place you can come back to at any time. If you've got any lower back pain or any pain through the spine in general, the all fours position means that baby's in that natural hammock position, which is perfect. So if you wanted to come out of it and you could just shake out your wrists or wiggle and sit like me on the hips or sit on your bottom between our exercises, you can also hold your wrists and roll them round. It's like a nice natural fluid movement to release any tension in the wrist. And then doing that because we're coming back. So we're coming back to the same all fours and we're going to do the all fours balance, which is basically opposite arm and leg, whatever is making sense for your body. Keeping the toe and the fingertip down, having a little balance, add a little extra hold. You can gently play around with it. Get familiar, do the calmest version first and then progress yourself. So I'll do some side on, I'll do some facing, but exactly the same. Plant your hands in the all fours position, and when you're ready, you glide and you slide away. So I'm looking up at the camera to check my angle, but what you can do is just keep your nose looking slightly ahead of you. So if you have a mat, it could be at the top edge of your mat. I'm just going to come and do it facing. So you're just going to breathe in as you come back to your neutral and the all 4 points connected with your mat again, and then exhale. So even if you're not lifting that leg at all, which I haven't done yet, I'm keeping my toe down and my fingertip down, you are going to be in a rhythm of exhale and power through the core. As and when it gets comfortable and you are confident, instead of keeping the toe on the floor, you lift to the parallel. So breathe in, have a longer pause if you need to. Exhale. So you are hovering. So you are lifting through the pelvis. You have got baby in that natural hammock again. You can add, as I already mentioned, the element of hold up here. Try not to let it creep into your lower back. Get into that glute. Use your core deep within the pelvis. Lifting pelvic floor if it makes sense for you, if it's synchronized with your exhale. So I'm going to breathe in, touch down, and exhale. Lifting away. Breathing in. Breathing out. Just gently tapping down. lengthening out and away. And again, you could just continue to do these, or you can put a proper number upon these ones. So you could do 5, 6, or 10 each side. Perhaps you'd like to do 12, because you could do 5 perhaps side to side when the toe and the fingertips stay down on the mat. And then you could perhaps do 5, like I am, hovering up here. You might add just a couple more, which I'll do for you, to each side where you hold. So you just hold whilst you're there, just for a moment, pause, have a longer pause down, and then off you go. Hold that second side, and that is a perfect combination. So if you ever want to sit up as well, and it feels a bit more comfortable to have your pelvis open and your legs open, you can sit like this. You can roll your shoulders after that one, roll them back. You could shake out the wrists or do anything that we've done previous together. You can also have thumbs up and just stretching your chest as you go. A couple of these are nice. And then we've got one side and then the other for us to do 2 elbow side plank exercises. So the movements are always what makes sense for you, but we are coming down onto the elbows. So you just shift your weight to the side, and always top tip, lots of space between my head or my chin or my ear and my shoulder. So it's never this if you can help it. So press into the elbow, pull up like you're being pulled out through the crown of the head. You can have both knees bent, and we're going to do hip dips. So other hand is there for support. You breathe in, lift if you can do it through pelvic floor, which just means right from the pelvis, just lifting within and lift. So you can also, if you wanted to, put a cushion between your knees if this is too much, and you can apply a little bit of pressure if you want to. So I'm just going to lift and lower, breathing in, breathing out. If this feels okay, you can always lift the arm and then gently come back down with the hand. Longer pause here. Exhale, lift. Breathe in. Breathing out. I'm just going to walk myself off camera so you can see this leg, because then you could have the straight leg. Leave that toe down. Do it this way perhaps. So leave that toe down. You breathe in. Same exact options. I'm lifting both hips. I could lift the arm. So you're going to breathe in. Breathe out. Inhale. Exhale. Again, you could do 5 of one, 5 of another. And you can also have both legs straight. So if this is for you, probably if you're earlier in pregnancy, so you can again use the side of the waist, lift and hold. It might be a little bit too much downward pressure on the shoulder or the elbow, might be too much pressure with the pelvis, but listen to the body. You could do 2 of these ones, and then just bend those legs, walk yourself forward, and we're going to swap and do the same on the other side, just so that you have a little mini pause and a relief. But if you want to ramp it up a notch, do both on one side, both on the other. So I'm swapping over. Same idea, same preparation, elbow, shoulder, lovely space between my ear and my shoulder. Knees could be zipped up with the extra layer of the cushion. Hand is down, we lift, we lower. So you breathe in here, exhale. Little mini tap down, exhale. So I'm going to do a couple more here. And then change the option for my leg. And I haven't even lifted my arm yet, so I could do that as well. So we could keep down, we breathe in, and you lift. You can tap back down on the floor, have a longer pause, and then up you go. Breathing in, breathing out. We're going to do 3 more here, and then I'll do a couple like I did last time of the straight leg option for you. So you can keep to 5, 10, 15, whatever number. 12 is a good number as well. Remember, zip up from the pelvis. Feel like you're lifted from within. So there's extra little layer of support. Pointed toes or flexed feet out there. Probably hand down is good. And you could lift, breathe in, lift, and then you bend the legs and you're back up again. So you can always lean back, but sometimes it's an idea to swing the legs into you, walk through the middle, and then find yourself ready on the other side. So we've already done the hip dip. Now there is options to do it with the hip up, but otherwise keep the hip down, have the top leg extended, and you can have hand down or hand up, and you're very straightforward going to lift that leg. So again, let me just come slightly on a different angle to show you. So flexed foot or pointed toe, Feel the stretch and the pull in a natural way across your hip flexor and lift that leg. Breathing in when that leg on that foot is down on the mat again. Exhale to lift it up. Let's do another 3, 2, 1. I'm just going to show you one more option. You don't have to have both hips up and the pressure on the elbow, because you could come to the side plank here, have both hands down and do a leg lift here. So I'm just going to show you 2, 3, 4, and 5. So it's a slightly different variation in case you wanted to take pressure off of the shoulder or you just want to have the arm straight for a change. We've got to swap to the other side. So it's about 10 or 12 reps again. Lengthen that top leg, pointed or flexed foot. Try not to roll forward or back. Stack those hips. Breathe in. Breathe out. Inhale. Exhale. Breathe in. Breathe out. Inhale. Exhale. So you're lifting that leg. 1, 2, 3, 4, 5. Lots of different options here for you. I'm going to just come up and show it on the side again, on the knee. So knee in line with hand, leg is out, hand is in front, and you're lifting. Let me just show it on the angle. So we are lifting. Always exhale to lift. Just going to do a couple more. And pause. Lovely. So just to kind of bring things back, having done some side-to-side work, giving you quite a few different options, you're going to come to all fours and do a figure of 8 movement. So you're sweeping to the top of the left and the right, sort of through the shoulders and the wrists, and then the same is true left and right down there at the bottom for the hips and for your lower back. So all fours is the start position. You could have knees together for a change, and you could sweep down around here, drop those hips, sweep it round, press it in, press it out, drop, roll, press, stretch, release, all of the above. I'm just going to come to the front for you. You might also just want to move those hands a little bit further away from you, out of the initial box position, and you are putting the applied pressure where is appropriate for you. So if you want to go deeper, push those hips out as you sweep round, deeper for the lower back, side of the waist. You want to go deeper at the front, it's for those wrists, sweep them front, and just make sure, I'm kind of doing mine as I go, but you can do all of the sweeping in one direction, make it nice and strong, come back the other way, and then you could pause to go the other way. So now I've flipped. I know you're doing a circle at the front and a circle at the back, so you might get a bit confused with which way you're going and how it's feeling, because ideally, you're just listening to the body and it feels good. So go with the flow, stretch and release, ease yourself through, and when you're pausing, we pause to open those legs, sit into a child's pose. So if you want to sit up on the heel of the hands, you'd like to sit up with my bottom and my heel connected, but on these fingertips. And if you feel okay to do so, and you want to do a classic one, you'd just be bringing your head or your gaze down towards the mat. And you might put your hands in front and you might let your head come down. Just be mindful in pregnancy, when the head is lower than your heart, just think about how that feels, because sometimes it makes you feel a bit dizzy. So staying down there in your child's pose for as long as you like, repeat the whole set, play it back, watch it, give it some thought, decide what works for you, take or add away for any different options throughout a week or the months that you are pregnant, because it still can be awesome in any stage, the beginning, the middle, or towards the end. And when you get towards the end and you might have the lower back pain, everything on all fours, or hip pain possibly, or just feeling like baby has dropped down, anything on all fours is a winner. So I hope you enjoyed that. I'm so grateful of you being here. Thank you so much for watching, and I will see you very soon.